In October, a team of 7 nurses, members of NISNA, and one doctor, concerned about the migrants' health, traveled to the border cities of Reynosa and Matamoros, Mexico, to provide free medical assistance to patients from different parts of the world waiting in Mexico for a chance to enter the USA. About 1,200 migrants live in Reynosa and Matamoros, Mexico border camp. Here, nobody wants to leave the enclave of the crowded field full of tents, not even to buy a bottle of water or to collect money transfers from his family back home. They are afraid to miss the ICE call. Besides the tents, other migrants are now living in informal shelters where there is little to no health care. Among hundreds of migrants were people from Cuba, others from several countries in Africa and Central America, waiting for an interview with an U.S. immigration officer. After 4 days, NISNA's team provided medical assistance to 276 patients.
We had a great time. We met a lot of people that had been through a rough time that we were able to provide a little relief to, that had traveled from all areas of Central America and Mexico. It was great to be able to help people that were having a hard time. I think it's great that NISNA is involved in medical missions, and I think it should only get bigger from here, giving more nurses the opportunity to have these unique experiences.
I had a wonderful trip. I think it was very wonderfully organized. I had a wonderful group of very fun, adventurous, eager to learn, open-minded nurses. We were willing to help one another out and do what we needed to help out the migrants and the community of Reynosa, Mexico. We saw, with the migrants, we saw people from all over Central South America, from Honduras, Cuba, El Salvador, people who traveled very far away with their babies and young children, living in these tents in degrees of 95 and above, just with basic necessities, but really needing help with basic health care needs that they aren't able to easily get. I'm grateful to, I think I can speak on behalf of all the nurses, that we were very grateful to have this experience.
I thought the trip was great. We were really able to help a lot of people that really needed it. If I had known about these trips before, I probably would have done it even sooner than now. It was a really good experience. It was good. It was a good way to practice a different sort of nursing than being in the hospital and having all those resources. It required some more critical thinking and thinking on your feet and utilizing what we had, which is the way that these people live their lives every day. So it was good to be able to kind of step in their shoes and see how they live and to try to provide as best medical care as we could for them. I think that NISNA should definitely continue approving these programs and expanding on them. If I could, I would try to do at least 2 of these a year. It was really fulfilling. It was a great experience, and if more people knew about it, I think that more people would sign up and they would be overflowing with nurses willing to do this if they realized what a great experience it was.